Hi, we're just a little bit early. We are waiting for everyone to show up. We're just testing things right now. Um, nope, I don't think anyone's watching quite yet, but in about 3 minutes, 7 minutes, we're a little early. We just don't want people waiting. I'm going to turn off the camera for a second here and just wait here while people join in. Okay. Okay. We're a little bit, we got one more minute. I see we got one person watching. Welcome. We'll give a minute here and get started. Okay. Oh, it's me on Twitch. Well, it is 3 o'clock. We will get started in just a minute here. Welcome to everyone who's watching. I'm Dr. Janice Makela. I am a hospice doctor and a geriatric doctor with over 20 years experience. I have a number of patients over the years who have used cannabis, and I've seen how it can help people. And so in the recent year or so, I've been learning much more about cannabis. And the thing I've learned is that there's not a lot of knowledge about it. Um, the medicine world doesn't know cannabis well. The cannabis world doesn't know medicine, and I am here to bridge that gap. So we are here to talk a little bit about the cannabis and the endocannabinoid system. Today I'm doing a Q&A. Hey, so, hey Ryan. So, welcome. So, today I'm going to be doing a Q&A on cannabis. And the first thing I'm going to do is I'm going to just do the first 10 minutes, 5-10 minutes, just answering one question that I've prepared so that we kind of get the ball rolling. In future, what I'm going to do in 2 weeks, I'm going to come back and do one on cannabis. Next week, I'm going to actually have a Q&A on hospice and palliative care. And so if that's something you're interested in, and perhaps geriatric care, elder care, my other hat I wear, right? And if you have questions about that, tune in this time next week where I'll be going over that. But in 2 weeks' time, if we have questions that are need more detail, I'm going to start at the first 10 minutes going over some of those questions. So don't be afraid to ask some hard questions. Okay, so the first thing I wanted to go over was very basic. What is the endocannabinoid system? We hear that term, ECS, endocannabinoid system. What is it? And it sounds very conspiracy theory when we say, oh my, the med schools don't teach this. Well, they don't. One, it's fairly new. In the realm of the medical systems that we've learned about, it's fairly new. Two, I think there's a little bit of a stigma because when we first discovered it, chemically, a lot of the chemicals in there, the anandamide and the 2-AG kind of looked like cannabis, and so they named them endocannabinoids. And people were like, it's it's pot. Why do we need to research that? And so as a result, we're really missing a huge part of what makes us us. Um, and only now are schools starting to catch up to this and teach kids about it. Kids, med students about it. Um, but So, first question, what is the endocannabinoid system? Well, first, let's talk about the word system. When we say in medicine, when something's a system, we mean it's not an organ. It's not a single organ like the heart. It's many organs working together, often communicating by either proteins or cells or chemicals in the blood that help regulate these interactions with each other. So, famous systems in our body would be our immune system. Um, Other systems, our reproductive system, our endocrine system, The renin-angiotensin system, which you'll hear me talk about a lot because I always say doctors always get taught the renin-angiotensin system, but we never learn about the endocannabinoid system. I'm going to talk about that briefly just to explain a little bit what a system is and why that is important. The first thing to know is that the renin-angiotensin system, among many other things it does, balances the fluid in our body, the blood pressure. And so if the heart has these sensors that say, oh, there's too much water in the blood, I have to work too hard to pump, it releases a chemical to tell the kidneys, pee, and or if it says, oh, I am way dehydrated, it sends a chemical to the kidneys to say, hold in urine. So that's part of one of the things of the renin-angiotensin system. It also works in the lungs. The reason I bring this up is because we have blood pressure pills, your ACE inhibitors or your ARBs, your meds that end with the ACE inhibitors, like anything that ends with pril, enalapril, lisinopril, and the ARBs, anything that ends with like losartan, anything that ends with sartan in it is ARBs. Those blood pressure pills work on that system to help lower blood pressure. Now, it turns out that these systems interact. So like ACE inhibitors, for example, are, work on that. But we have ACE receptors, ACE2 receptors in our lungs and in our nose. And the SARS virus, the SARS-2 COVID, right, was binding to that receptor in our nose and our lungs. And that's how people were getting it. And so you have an interaction of not just the renin-angiotensin system, but you have an interaction of the immune system, right, as you get a virus from it. Then the other thing that's really interesting is CBD. So that's our endocannabinoid system. They did a study to find that people who took CBD regularly were less likely, significantly less likely to get COVID. And the reason is because in your nose, you made less of this ACE2 receptor when you had CBD that you were taking regularly. So that's where this kind of interaction, it's not just a standalone system. So that's what a system is. Now, when we talk about endocannabinoids, when they first discovered them, they found two of them, 2-AG and anandamide. I totally said that wrong. But 2-AG and anandamide, there we go, are two of them, and they look very similar to THC. So they said, oh, they look like THC. Name of that system for us layman folk. I will in a second. It's what's the endocannabinoid? We call it the ECS for short. I'll get to it. But so what happens is that so what happens is that these two chemicals, it looks like THC. They called them endocannabinoids. Endo is a fancy Greek word meaning inside our body, as opposed to exo, outside our body. So cannabinoids are things that come from the cannabis plant. So they're like, oh, this is what our body naturally makes. That's like cannabis. In fact, the first one that they discovered, the anandamide, is actually from a Sanskrit word meaning bliss, because it's like, well, if cannabis makes you happy, so does this. Which again kind of has downward effects that we kind of just think of it as the chemicals that get you high. But it turns out these are actually part of a very fine-tuned system that helps regulate our heart, our lungs, our immune system. It's on fat cells. It affects our appetite. We all know about it giving you the munchies, right? But it also can help inhibit your appetite if you need it, that because it's a balance. There's also foods we take that can affect it. Omega-3 fish oil and any of the omega-3s, but particularly the fish oils, get converted into other chemicals that we now recognize to be part of the endocannabinoid system. Omega-6, which is some of your seed oils, not all, but your seed oils, right? And other things, lot and it's present in a lot of the heavily processed food, gets converted also into some endocannabinoids. And there's a theory out right now that's gaining a lot of traction with the research to suggest that our diet is actually supercharging the ECS system in our body. And that's why we're always hungry. It's literally giving us the munchies, right? And this is why we're getting heart disease and all of these other things. So that is what the ECS is about. It's not the thing that gets you high. It's a system that is balanced and it controls other things. It controls the brain. It works with myelination. So the nerves, some nerves have a special fatty coating on them. See those fat cells I was talking about, like the omega-3s, right? I have a special coating on them called myelin, and it's very fat based. That helps those cells move better. Schizophrenia is when there's a problem, and it usually happens, in the early 20s, right after teens start going through that process of myelinating part of their brain. In the late teens, early in late adolescence, there's changes to the brain where you get more myelin in it as your brain kind of develops out of that teenager brain and into more of an adult brain, right? That is regulated by cannabis, not cannabis, by the endocannabinoid system. Um, and omega-3, there's been some studies, omega-3 and even CBD, but not THC, that's a different story, um, may prevent some of the development of symptoms in schizophrenia because they're finding that's a role. Conversely, MS is a disease where you have demyelinization. Those nerves break down the myelin. And that's likely why cannabis helps that. So you have one condition where it's too much and then another condition where it's not enough, right? And so again, that balance, you know, that's why there's probably some people who can't take THC because it can induce psychosis if they're prone to schizophrenia. Conversely, someone with MS who doesn't have enough of it is going to need more of it. You want to give it to them because that system is broken in them. So that's your endocannabinoid system, and that's my brief little summary of it. Um, does cannabis have a positive effect on hypothyroidism? That is an interesting question because I actually do not know that one. I I'm going to write that one down, and if I find an answer, I'm going to post it on there. Um, and let me write that down because you stumped me. I don't know. Can cannabis help the hypothyroidism? Um, I mean, like I said, they talk to each other, and these systems do interact, but I would have to actually see. Can it replace the medicine in people who are hypothyroid? Oh, I'm going out of focus. No, it can't. Um, if you have hypothyroidism, you're going to need the thyroid medicine um, because your body's not making, your thyroid isn't making enough of the medicine it needs. And there's a lot of different things, whether it's damage to the thyroid or other conditions, immune conditions that can cause that. Um, Camera, there we go, back in focus. So I would not use that instead of, I would not use cannabis instead of the doctor prescribed meds. Now, whether there is some interaction between those, I'll look it up. I'll get back to you. Thanks, Lance. Um, and then Ryan, you asked the name of the system for us, and so let me see. I'm going to write it here on the thing, um, on the chat. I can actually. Here you go. It's the endocannabinoid system. Okay. So that's the endocannabinoid system, also called the ECS. Okay. I see we got people from a lot of other places, Iceland and Toronto. Um, so any other questions? So now what we're going to do is I'm going to just open up the questions. It's not just going to be about the ECS, though certainly I can go on and talk a lot more about that. Um, but about anything with cannabis. I want this to be a very interactive thing. I want you to bring your questions to me. You know, and as with Lance's case, if I don't know the answer, I'll look it up and I'll post it on LinkedIn or wherever. Or and in 2 weeks when I come back for to talk about cannabis, I'll start some of the beginning, addressing some of these questions. Um, yes. So, anyone else? Oh, okay. So let's talk. So one of the things again is why isn't this taught? And I think a lot of the reasons the cannabis system isn't taught is because of the legal status of cannabis, right? And this whole idea that this just has something to do with getting high. And so why would we have to learn it? Um, the excuse me, but the endocannabinoid system, so other diseases. Let's just talk about some of the other diseases that it can work on. I mentioned MS. I mean, we talk a lot of been real studies to show that it can help s- no, the other system. Oh, ha! Thanks, Ryan. I'll get to that. Um, so Parkinson's. Yes. Yes, it can. So, okay. So first of all, the renin-angiotensin system. Here you go. I'll type it in. Renin-angiotensin. So the you'll recognize sometimes if you're on a medicine called an ARB, it is actually an angiotensin receptor blocker. That's what ARB stands for. So that's part of it. Does cannabis have a positive effect on Parkinson's disease? I've heard both positives and negatives. Yes. Yes. So what I have seen and, heard of and stuff is that you probably want to be a low dose. You don't want to be like using high doses on it. Probably one of the biggest concerns is falls. Now, the studies I've read say it doesn't really decrease the risk of or increase the risk of falls. In fact, there's a few that it might even decrease the risk of falls. Um, and the reason is because well, one, the cannabinoid system might be doing a little bit of neural protection in the brain. Two, it might be because of that whole immune thing, it might be decreasing some of the inflammation around that area. In Parkinson's, to go back a little bit, Parkinson's is a disease where the dopamine cells in a very specific part of the brain, the striatonagral part of the brain, um, is degrading over time. And that causes a lot of movement disorders. That causes the tremor, not the intention tremor. That's when someone moves, that's a different thing. This is traditionally a resting tremor. So they're just sitting there and their hands are tremoring. But it also can cause sort of a rigid posture and, and a loss of balance. So people with Parkinson's are much more likely to fall. And so there's actually some data to show that it probably is what it's doing is increasing the dopamine in the part of the brain there. And so it's kind of supplementing, but it might even be protecting it. Um, and so people are protected from the degradation of the disease. So I would say the data I've seen is that it's helpful, but I would go low dose. You're talking about a population, again, they're prone to falls. You do not want people confused. I talk about that with dementia. You have someone, you use it for their behaviors in dementia, but you don't want a dose that snows them or they sleep a day and a half, nor do you want a dose that gets them so out of it they don't know what they're doing, right? So I would I usually start with like 2.5, maybe 5, but I would work people up slowly to see what they can do. And then pull back if we start seeing side effects. If they're like, "Oh, no, no, he's too dizzy with it." Okay, maybe that's not the right drug. Not every drug is the right drug. Just because we love cannabis for many of our patients doesn't mean it's perfect for everyone. So you would go very slowly. And I think there's some evidence that in these neurodegenerative diseases where you have brain breakdown, Alzheimer's, Parkinson's, ALS, MS, that it actually has some protection to the brain. So that's my take on that for Parkinson's. Um, Again, Alzheimer's, I think it has some benefit. There's a lot of studies about the behavior with Alzheimer's. Um, yes, THCV. I have heard some stuff because it does have some neuroprotective properties. I'm a little bit scared of THCV. And this is just me. A lot of experts disagree. Um, yeah, I can mention that too. Um, but the THCV for Parkinson's. Oh, here, I can actually do this. Huh. So the THCV for Parkinson's, right? Um, THCV is a blocker. And there's some studies to show it might have some neuroprotective, some definitely appetite suppressant. So again, one thing with dementia, people lose their appetite. Not a huge fan of that. Second thing is THCV. Many years ago, there was a drug that came out. I never can say the name right. Remambavent, something like that. And it came out in Europe. It did not get FDA approval. And that came out, and that was one of the first times I heard about the endocannabinoid system because a drug company was actually footing the bill. They were A friend of mine was an endocrinologist. She's like, "Oh, we're going to the swanky restaurant. They're going to teach us something." And they couldn't talk about the drug because it wasn't FDA approved, but they all wanted us to know what the endocannabinoid system was because it blocked the endocannabinoid system. It blocked the CB1 receptor. Now, what happened with that though is two things. One, there were some case reports of people with MS, with latent MS, who started getting symptoms. Not a good choice for people with MS. Second, um, there was people, it increased the suicide rate. That scares me a little bit. I mean, I've read some repeated studies recently to suggest that that was over exaggerated, that it was just barely and stuff like that. But yeah, there was a lot of people who were killing themselves on that. So I am very hesitant of anything that blocks the CB1 receptor. So THCV. Now that said, I know a lot of experts, people who have been doing this a lot longer than I have, who swear by THCV for appetite and other things. Um, I would be very cautious if someone has a history of severe depression, though, of taking this. Um, I would just be very cautious about that. So that's my take on that. And yeah, you're right. It was a complete blocker. And to be fair, THCV is not a complete block. It is actually having more thing. Yeah, there you go. Oh, here. Thank you. Yes. That's the name of the drug. Rimonabant. It was antagonizing the CB1 receptor, so it was a complete block. Whereas, to be fair, THCV isn't has of a complete block. And even in medicine, we see that sometimes metformin, for example, diabetes medicine that's been used for decades. When it first came out, the first version of a drug, which we don't ever use anymore, was pulled because it was making people very sick. Uh, getting the metabolic acidosis and stuff like that. We won't get into all that, except for to say that for most of my career, we've had very strict things about, okay, if they're going to have surgery, we're going to hold the metformin. If you're going to have contrast dye, we're going to hold the metformin. If the kidneys are a little worse, we're going to hold it. And now after 20, 30 years, we're like, okay, we overshot that. The other drug was different enough that metformin, is safe. We can now use it in people whose kidneys are, borderline. And so your point is well taken, Evan, that rimonabant is different. It's a different drug than THCV. And so it may act differently. That's just my personal caution and the one thing that kind of scares me a little bit about it, just to say, right. So that we got a lot of fans of THCV. Um, right, and that's it. It's like there are some people who it helps, and as we get more and more usage of it, part of the problem with a lot of these new cannabinoids, I say the new ones, right? The THCV, the CBGA, the CBC, right? Is that there's not a lot of human studies yet. THCV is actually one of the exceptions. It has had actually some studies to show that it can help with appetite. And so that's again why more and more people are using it. Um, so yeah, again, just my caution on that, that if you do use it and if you're prescribing it, just keep an eye out for that. Mm. Let's see. And then, a couple other interesting ones from like metabolism standpoint. Let me just get that one off. Right, exactly. So is CBD isomized, right? So the other thing is that a lot of the cannabinoids, we've had some animal studies, we've had in vivo studies, human studies. Like personally, part of what got me down this path was I was hearing a lot of people, a lot of the doctors who do cannabis talk about THCA. Um, um, I think we'll have to do a future webinar on THCV. We definitely have a lot of popularity on that. Um, And, another one that we don't have a lot of studies on is THCA. I mean, as partially because it degrades to THC so quickly, and so it's hard to get a pure study of it. But there were some animal studies to show that it actually reversed fatty liver. So fatty liver is something you see in a metabolic condition, right? Where a person has diabetes or maybe pre-diabetes, and the liver starts getting fatty depositions in it. Actually, little fat particles start accumulating in the cells of the liver, and you can eventually see this on a CT scan, and we call that fatty liver. And it can lead to liver failure. And so there were animal studies where THCA actually reversed the fatty liver in the animals, but they haven't done the human studies on this. And so that's frustrating. But you're right, THCV does have some studies to show it can help with metabolic. And it may be a future day that we have, um, it may be that we have a day when THCV is used, especially as we learn more and more about the endocannabinoid system. And that's part of the whole issue is that it is tied to our metabolism. You know, I mean, when you think about it, omega-3, right? When we talk about omega-3 fatty oils, we're talking about fish oils. We're talking about um, um, why am I flaxseed, hemp seed. is a huge source of omega-3. And so those things, those types of oils help get our body healthier. Well, what is the one proven diet in medical literature? Okay, there's one, and I can never remember its name, but it is so bland. It's like the cardiology recommended one. But the other one that has real proof is I'll talk to you about that in a second. The um the other thing that is with the CB, sorry, I lost my reading about the other thing that we see with a omega-3, right? And that diet is the other diet is the Mediterranean diet. Because what is that? That's fish, it's whole grains, it's vegetables, a little bit of wine, socialization. So again, good for the body, is associated with longer life. And really, what we're talking about, you know, that type of thing is the Mediterranean diet. And if we just expand that, you can look at other systems. Um, um, I often joke a little bit that the true South American Mexican cuisine, yes, hemp seed, exactly. Um, I call it the Mexicaterranean diet. When you talk about avocado oil, when you talk about vegetables and whole grains again, actually a lot of fish, a lot of grass-fed animals and stuff, right? People who grew up in rural Mexico actually live longer and have healthier lives. So I think it's more than just the Mediterranean diet. I think there's this kind of principle of diets that balance the ECS. Um, Now, here we go. I have a question here about the CBC. Right? CBC, it's another new one that's fairly young or fairly recent. Let me see something real quick here. Yeah. So, again, it has some anti-inflammatory properties to it. A few human studies. Again, I think that would be another great topic for another one where we just kind of break down some of these yeah, I said endocannabinoids, some of these cannabinoids and learn a little bit more about them. Because a lot of them, I was reading even about some of the terpenes, right? Pinene, for example. I was reading a lot about it last week, and it has antibacterial and antiviral properties to it, in test tubes and stuff like that. But I'm like, huh. There's a lot of studies about CBD and THC in wound care, healing wounds that other stuff doesn't help. And I'm like, huh, put a little pinene in there, and you will decrease the chances of them having an infection. So there's a lot of really interesting things about that. And yeah, the let's see, what else do we have? Uh, Emerald Spirits Botanical, they grew pink. Huh, interesting. So they have a THC dominant one. I just recently was reading someone talking about how THCV combined um, with THC doesn't quite have the same effect. I don't know enough about that. I could see that because one's actually an agonist, the other one's an antagonist, so they'd be counteracting each other. Um, the other thing is here, what is this? Someone was asking about when I was talking about the THCA, about the molecule THC or the products being sold through the semantic loophole. You know, so I'm not talking about the stuff that people buy and then smoke, but kind of because you can take that and make an extract out of it that then you can't smoke. And then that extract can have some benefit. So I am talking about THCA as the chemical, you know, with the idea that you could make an extract out of it. the first time I heard about it, there was, I think it was, someone was giving a lecture and they were talking about how sometimes they have people take THCA teas. Tea, not tea like the letter T, but tea as in a drink, right? Of tea. And so that has, of course, the heat in the tea is going to activate some of that THCA. There's actually a whole thing on that. I was in some parts of Europe, you can have a tea. I think Italy made it illegal recently, but for a while, you could have a tea out of THC. And so there was a research done and they were using a standardized plant made by a company in the Netherlands that made standardized plants for the medical thing. And then they would take the standardized plant and put it in a tea. And you found that it only like 2% of the THC actually made it out of a hot water tea. Now, if you put it in, you boiled it and boiled it, you could get more. But if you just like steeped it, it wasn't that much. Though, if you added creamer, then it jumped up to 20%. 'Cause it absorbed in the fat if you added creamer and heated it up. That I found that very interesting. So to answer your question about THC, um, yeah, I'm talking about THCA. I'm not talking about THCA that can then get smoked and changed into THC because then that'd just be THC. Um, now, a lot of terps, right? Well, yeah, and there are so many terps. And the real question, what's interesting is because some of the terps we actually have some research on because they're in other plants. So a lot of the stuff I'm pining was actually from sage and rosemary, you know, research where that also had pinene in it and extracts. Um, yes, that's absolutely right. That's actually where I first heard about it was people who couldn't tolerate the high of THC found it better when they used THCA for their nausea. Um, Now that said, I find a lot of people who just use small doses are still pretty good with that. But yeah, so I agree with you. The anti-nausea is perhaps the biggest thing about it. Now, personally, I'm not sure how I would enjoy the taste of a cannabis tea, but if it's health for you, that's okay. Uh, I'll stick to my Earl Grey. Yes. So that's some things here. Now, wait, go forest bathe. I'm curious, what is that? Is that a type of to the LinkedIn user who said forest bathe? Is that a type of a plant of the cannabis plant? Is that a cultivar? I'm curious. Let me know. Um, you know, one thing I will say as a doctor, we're not big fans of people smoking the cannabis. There is vaporizing, um, where you take the whole leaf and then you put it like one brand's volcano, I think it's called tea. Yes, yes, someone got the reference. All right, tea, Earl Grey hot. That's exactly Star Trek. Another Trekkie out there, Picard. So, but what I was going to say about that was that there are things called vaporizers, right? Where you take the whole leaf. Now, not to be confused with vapes, um, but you put it in the machine, and then it heats it up just enough that it releases the volatile compounds, including the THC and everything else, and then you actually can inhale all of that without getting the combustion products that might potentially be bad for you. Um, no. So, yeah. Does bergamot have pinene? I'm thinking that's what you're suggesting? The thing that makes tea Earl Grey, flavorful. I wouldn't be surprised if it does given its flavor profile. Walking through the forest like pine trees and such, the Jap again, yeah. You know, that's inhaling all there's something to be said about that's feeling good. And there's studies, right, to show that, pining, again, may be very healthy for you. Yeah. But certainly walking through a forest is extremely healthy for you. I can't argue with that. Mm, I gotta go hiking. So, yeah, the other one that we see a lot of research on is like the limonene, right? Because it's in lemon, it's in citrus. Oh, William, yes, hi. I'm not sure why either. That's weird. The Nice to see you, William. I know I've seen you on LinkedIn before. I appreciate everyone showing off and uh the and coming in to be part of this conversation. I hope you're enjoying it. Um, yeah. Now, medically, I talked about the lungs a little bit, but one of the other things is that uh, really, that's actually interesting. Well, you know what? Let's talk about that because I hope save that other point for another day here. And it's here. Ever hear of chewing on a lemon or lime slice to calm anxiety? I have not heard of that. It kind of makes sense though. I mean, when you talk about lemonine having an anti-anxiety component, again, something to look up to see if that's if we have a lemon for anxiety. I'm going to add it to my look up list for anxiety because I'm curious what the research on that is. Because things like the pinene and the limonene, they've been doing research on them not because they were in cannabis, but because they were in other botanicals. So it makes sense to me. Huh. So you've tried it? Does it hurt your teeth? Chewing on Oh, my husband loves really sour stuff too. I never thought that it might be just making him feel better a little bit. Um, but I would think that would all that lemon on there, chewing on it would be so bad for the teeth. But I could also see where it might make someone feel good. But you know what? For me, my favorite smell um, is actually a is actually on the lemon citrus sense, like when it's perfume. The perfume I've been using for the last 20 years has I love the smell of because it has it's not lemon, it's a different citrus, something from France or whatnot, but it is a citrusy smell, and I just really enjoy that. Now, not that artificial one, but not like chewing gum. Okay, good. So hang on a second. Um, oh, okay. The so Yeah, so that's that. So a terp is a terp, right? I mean, and there might be something to be. I joke a little bit. We're just out of view of it. I'd have to walk away and grab them, but my marigolds, I grow my own marigolds from seed, and they are terpene filled. I forget which one's in them, whether it's the pinene, but that smell that keeps the bugs away. The reason I grow them is because they keep the bugs away from my other plants. Because that really pungent marigold smell is very terpene. Um, yeah, is very terpene rich. and those terpenes keep the bugs away. Um, and I personally enjoy the smell, but it is a very strong marigold smell. So Russ has, yeah, there are some experts for sure out here who know a lot more. I'll have to look up some of his stuff because there are a lot of experts out here who know a lot more about the terpenes and a lot more, in their years. Um, I'll be the first to admit there are people who have been doing what I'm doing since it was first legal, and they're going to know more about stuff. The medically, I'm a hospice and geriatric doctor. So where I see it a lot more is end of life. You know, people need it for nausea who have chemo, or people who have nausea because of their disease process, pain. Um, I would save this maybe for another one, but we could just talk real quickly. I mentioned, the endocannabinoids in the brain, right? Um, there is this area of the brain called the paraaqueductal gray, um, citronella, right? And that causes is actually where pain is processed. It's one of them. It's actually where the inhibitory pathway for pain begins. Because remember, I talked before, every system in your body is a balance, a little upregulated, a little downregulated, back and forth, right? Pain is no different. It's not like we just have pain. It's like we have pain and then our body has ways to downregulate it. And it makes sense evolutionarily speaking, because if you're running from a saber-toothed tiger and you fall and sprain your ankle, you want to keep running even though your ankle hurts. So you have a system where adrenaline actually will tap down the experience of pain. That's why if anyone watched Forrest Gump, he gets shot. He says, then something jumped up and bit me. He's not even aware he got shot. That's a real phenomenon for some soldiers and people with high anxiety. They're not even aware of the pain they're experiencing. So the very first receptor in that pathway is the CB1 receptor. So that's why it helps with pain. That's why even some of these cannabinoids, the other thing that some of these things like um, CBD works on is the TRPV1. Another thing I grow in my garden, speaking of garden stuff, the hot peppers. The TRPV1 is the hot pepper receptor. It's what makes hot peppers burn. But in our body, it's also like a pain and temperature regulation. So Tylenol, it actually activates the TRPV1 receptor. It becomes another drug, AM404, in our body that then activates it. And then it does two things. One, it regulates via the endocannabinoid system temperature, right? Then the other thing it does is it activates that inhibitory pain pathway by activating the CB1 receptor. It's one of the few places where TRPV actually upregulates CB1. Usually it downregulates. But morphine works on that pathway, but at a different point. That's why it works with pain. The other thing I think that helps, and I had a whole little blog thing, an interview I did with someone on this, is is that suffering and pain are different. And whereas I do think morphine has a very important role, I don't think cannabis works as strong for certain types of pain um, as morphine does. I think morphine has a weakness in that it doesn't do a lot when it comes to the emotional responses to pain. So I think a lot of times people feel pain, right? Maybe they still feel the pain a little bit with the cannabis, but because it also affects the amygdala, which is part of the emotional parts of the brain, people don't care as much. The suffering is less, you know. And so I think there's something to be said about that. That's a whole other topic I did at one point. Retta for topicals, right? Now, Capsaicin, because it's on our skin, right? There is we use actually capsaicin cream for neuropathic pain. It's a little annoying because it hurts at first because it stings because it causes the release of substance P from the nerves that causes activation, just like burning from your mouth. But if you use it over and over, just like if you keep eating hot food, you get used to it. Um, the Just like that, that is the um you get used to it and it sort of down regulates it. There's a few other things involved in it, but that's also why maybe CBD might be a very good thing, even some THC, but might have some real good role in neuropathic pain, nerve pain, particular like sensitivities. Like if you're like, oh, I can't touch that area because it hurts. Like you might get after a shingles outbreak, for example. Um, that might be very helpful. So, yeah. So when you talk about capsaicin and then um, topicals is a whole other debate because we do have CB1 receptors on our skin, along with the TRPV1 receptors. So something topical would have an effect on it. The question is how deep. I myself had a number of geriatric patients who would use it for arthritis, put it on their joints or on their back and said, oh, I feel so much better. I have a colleague who feels that that's nothing but placebo. Maybe it is, maybe it isn't. But I certainly had a number of patients who would argue that it was helpful. Uh, So, let's see, it is 3:50. We've got a time for a couple more questions if someone else wants to bring up something. We don't even just have to talk about the endocannabinoid. We could talk about like the medical stuff of it or regulation a little bit. You know, I mean, one of the challenges, like there's not a lot of doctors in this space, and part of that is because the FDA, made this it's Schedule 1. There's a lot of doctors who are scared to even touch this because, oh my gosh, I might lose my license. So there's as a result, I think that's where that gap gets in. There's not a lot of people who know medicine who know cannabis, and not a lot of people who know cannabis who know medicine. Um, but yeah, no, to your point about the capsaicin and the topicals, for topicals here, you know, that 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 is exactly what it can do. Again, I mentioned before wound care. Um, Wound care, so wound healing is a whole system in of itself. And a lot of diseases like Alzheimer's and even diabetes make you more prone to getting wounds. There's something in the system, in broken Alzheimer's, in diabetes, that makes you more likely to get a wound. If you're going to, and more likely that that wound will not heal. This is why you see people with Alzheimer's with advanced bed sores. This is why you see people with diabetes. It's a little bit more complex. Diabetes, you also have a decreased blood flow because of damage to the blood vessels, clogging the arteries to the feet, for example. But there's something more to it, and I suspect we will find, and this is just my theory, unless I find something else on it, that we'll find that the endocannabinoids are play a role in skin homeostasis. That's why we probably have it on our skin receptor, on our skin, right? And because skin is actually our largest organ. It's an organ. We don't think about it, but it's living, right? There's it if you cut it inflames, it heals, it closes, you know. There's a whole bunch of processes. We get hot, we get cold. the hairs on our skin will stick up, right? Our skin will flush when we're warm, when we have to get temperature off of it. If we just ran a marathon and now we're hot, um, our face is all red because it's um, emoting heat, right, as part of thermal regulation. Well, we already know that cannabis is responsible for thermal regulation. I wouldn't be surprised to find out that there's canna that these cannabis receptors on the skin do a lot more than we think. In fact, we already know that for eczema and a lot of dermatologic conditions, it can help. Back to pining. That was the really big shock to me was they've actually done studies. They actually took volunteers and induced a skin disease. They gave an irritant and then they gave them pining patches. And they had three different spots, one with pining, one with just the gel that the pining was in, the placebo, and one with nothing. And yes, there was a little bit improvement with the gel because the moisturizing, but the pining, you could definitely see it at like day 12. It was healing up significantly. I don't know how much you had to pay someone to say, oh, we're going to give you a wound on your skin. Now let's watch it heal. But that's what the study was they did. Um, it is 3:55. Does anyone else have any last minute questions before we wind up for the night here for the day? It has been a wonderful time. I really appreciate all the interaction between the chat here and all the people who had questions. And I really wanted to say, next week I'm going to be doing this again, but I'm going to do this one on hospice and geriatrics. So if you have issues with caregivers and loved ones that you want to talk about, um, if you have, well, not specifically, obviously as a doctor, I can't be saying, okay, this is what you're going to do. But if you have questions about dementia or elder care or questions about hospice, what it is, what it entails, palliative care, which is what is palliative care, right? That will be a question we'll be talking about next week. So we'll be going on that next week as we talk about things. And then the following week, we'll come back to cannabis. And I think what I'll be doing is I think I'm going to be reading up between now and then a little bit. I do want to find out about the connection between hypothyroidism and cannabis, uh, a little bit more about anxiety and citrus, right? And a little bit about the TRPV, not TRPV, I'm sorry, THCV. I know we had a bit of a conversation. So I really appreciate everyone coming. It's about 3 minutes till. If there's no other questions, I'll hang on until the hour here. But I think I'll be wrapping up. But I'm so honored you guys all decided to spend your afternoon here and talk with me about this. It was really enjoyable. Um, I really appreciate it. Thank you guys. And let's see. I just so yes, next week, same time, hospice palliative care, geriatric medicine, elder care. Bring me your questions. 2 weeks, we will come back with more questions about cannabis. I hope everyone had a great time. I'm going to just log off, I think, a couple minutes early. And I hope everyone have a great day and enjoy your week. Thank you so much and stay blessed.